Welcome back to Credentialing Chronicles, where we spill the doctor's tea hotter than your morning coffee.
And give you the insider scoop on the wild worlds of credentialing, provider drama, and everything they don't teach you in med school.
I'm Shannen, and she's Nyleen, two credentialing pros with front row seats to the chaos, looking to make you a part of it. Yes, we want you to engage in spilling this tea with us. We need your love and likes, and we want to know what you think too. Look for us, please, on LinkedIn, Instagram, and yes, baby, even TikTok.
Yes, we love to see your love. From fraud scandals to burnout breakdowns and why your favorite surgeon might actually be banned from 5 hospitals.
Honey, we've got the gossip and the practical advice to keep you out of trouble and ahead of the game.
So grab your coffee, your compliance checklist, and maybe a lawyer, and let's get into it.
Hey, welcome back to Credentialing Chronicles, where paperwork means panic and sometimes prosecution. I'm Shannen.
And I'm Nyleen, and today's episode is an important one because more and more medical practices are adding behavioral health services or like some kind of like psych stuff. And while that's a meaningful step forward, it needs to be carefully thought out. Billing, credentialing, and compliance for behavioral health aren't the same as traditional medical services. And if the right pieces aren't in place, it can create real challenges.
Definitely.
So we're here to walk you through what it really takes to build a behavioral health offering that's compliant, sustainable, and then truly serves your patients and, of course, your providers.
Exactly. I mean, a lot of people think that behavioral health billing is just, a few extra codes, and it's really truly a whole ecosystem within itself. And, we really wanted to bring it to you all today because we know a lot of providers are listening to our podcast. And, this is a question that has come up several times to us. And so we thought, why not do an episode on it and really explain it? And if you don't credential, enroll, and bill properly, it could get caught up to you. And that is our number one thing, is to make sure you don't get caught up in no FBI stuff.
This episode of Credentialing Chronicles is sponsored by MedElevate Solutions, your partner in turning healthcare chaos into operational clarity. With deep expertise in ASC, hospital, or physician office operations, clinical workflows, and compliance, their team helps you work smarter, not harder. Learn more at medelevatesolutions.com, simplifying processes, amplifying outcomes, one facility at a time. So first, let's start with what is actually behavioral health billing, right? So let's define it. So behavioral health billing includes services like therapy, psychiatry, substance use counseling. So these services are typically billed with codes like a 90791, a 90837, 90853s. These are CPT codes for our patients listening, procedure codes or E&M visit codes. These are codes that we use to bill out a type of service, regardless of whatever that service may be.
Exactly. And often behavioral health services require completely separate credentialing. That's something that we have to remember. From medical services, even with the same insurance company, you all. Just because you're already in network, let's say with Cigna for medical, doesn't mean that you're automatically approved to bill with Cigna, which usually goes through Optum, or Carelon, or, for behavioral health. And so you just want to make sure we're going to tell you the tips, the tricks, and the trades in today's episode.
Right. So what a lot of practices don't realize is that many payers actually subcontract their behavioral health networks to entirely different entities. So for example, your medical contract might be, you said, right, Blue Cross, but there's an entire separate section for behavioral health. Even when you call in to get a claim, it's like, is this medical? Is this dental? Or is this behavioral health?
Exactly. And, sometimes the pay is coming out through a Medicare program. It's being credentialed through Optum. Literally, it can go through five hands before, you ever even get a payment. And that means that your behavioral health providers, and we're talking therapists, right? We're talking LPCs. We're talking LICSWs. We're talking LCSWs. Your psychologists, your counselors, have to go through that specific vendor's application and credentialing process. It's a separate portal. It's separate contracts. And to be honest, you guys, it's separate timelines as well.
Yeah. And if you skip that step or assume you're covered just because your practice has a medical contract side, you're setting yourself up for denied claims, delayed payments, or worse, unintentional fraud, right? Or you're going to end up having to say, oh, this is a self-pay service.
Exactly. Yeah. And then, it's out of network, right? This isn't just a formality, truly. Billing under the wrong contract or using the wrong NPI when your provider isn't credentialed with the behavioral health side of things. It's really one of those red flags, Nyleen, that we talk about all the time. And, it's really one of those things that kind of trigger audits, right? If you've never billed under for BH services and then all of a sudden you're billing the medical portion of it for some BH services because, let's say you're trying to be more patient-centered, patient-focused, and you want to take care of the totality of the patient, those really can trigger those audits. And that's what we're really trying to stop here and make sure that you guys know about.
Right. So the key is before you launch anything new, okay,
yes.
I don't care if you're a surgery center, a hospital, a practice, we're talking across all services. And I know we're specifically talking about behavioral health right now, but any type of new service line, and especially one like behavioral health, you want to make sure you've confirmed, right, how each payer, how their behavioral health network works, and start credentialing accordingly. Don't rely on assumptions. Get everything in writing, because this one is usually a little more complex than what it looks like. So if your plan is to have a new therapist bill under your family practice group NPI using a 99213, you're already off track. Like you don't use an E&M code, right?
And really what we're thinking about when we get it is, the demand is real. So we understand why a lot of practices are bringing in BH, and it's great because, you go as a patient, you go to one practice, you get all of your needs taken care of there. It expands services. It meets the patient's needs. It creates new revenue stream for the providers, for the practice. And generally, it truly supports mental health in their communities. And honestly, that's a good thing when we're talking about all the mental health issues that we're seeing nowadays in 2025. And you can absolutely transform the way that patients experience care using behavioral health services. It makes things more whole person, more accessible, like we talk about. And that expansion comes from responsibility. And, as it's not as simple as, you hire that therapist, you're putting them on the schedule next Monday. There are layers, and we want to just talk about them and kind of break them down. We're talking about credentialing. We're talking about payer enrollment. We're talking about billing compliance, even internal workflows that have to kind of shift now that you're going into the behavioral health side of things. And if you move too fast, what do you think, Nyleen? What can happen if people move too fast?
You're not going to get paid. You're not going to get paid, and everybody wants to get paid.
She's so verklempt.
Well, the thing is, we're seeing primary, especially primary care. I've seen a lot. Primary care, they're like, oh, we're just going to hire, you're going to offer some psych services. I've even seen someone graduate with like a doctorate degree, and then they're offering quote unquote counseling services. And it's just kind of shady, right? So we're seeing like urgent cares, pain clinics, and even like OBGYN groups add a quote unquote therapy without adjusting their billing or their credentialing or their contracts. So it's like, how do you expect to get paid for that? And then how are you verifying that this service or these services are being provided by the right provider, right? Do they have the qualifications to provide those services, right? Have you met all the criteria to be able to add and provide that service line to your patients?
And that's what that's what the plans are going to look for, Nyleen. That's why they want to separately credential them. When you're looking at a therapist CV, they want to see the supervision on the CV. They want to see, that you have the amount of appropriate hours before they even want to credential that provider into the plan. And, they assume just use our MD's NP, it'll be fine.
Oh, no.
And,
No.
you really can. It's a therapist. If the billing is done under the wrong taxonomy, you're really walking into a compliance landmine, and we don't want that for you all, correct? I mean, I don't. Nyleen doesn't.
NPIs. We try
taxonomies,
to tell providers.
Those are things we talk about.
Numbers and then taxonomy that's tied to that NPI matters for billing. And sometimes they look at you like a deer in headlights. They're like, what's that? I was like, oh my goodness. So anyway, let's talk process, right? So behavioral health providers often need separate credentialing with a behavioral health network, not just the quote unquote medical plan. That's why it's listed separately. When you run benefits, you see there's behavioral health is very different than medical, right? It's a whole nother separate thing.
And, that means you have a new application, you have a new contract in many states, extra Medicaid registration or supervision attestations are required, like we just talked about.
Yes, and they need to be credentialed as themselves. You can't sneak a therapist's work under a physician's NPI because it's not like a PA or another provider you're attaching to something. Like, no, that's fraud. That's not flexibility. A therapist cannot work under, a physician's NPI.
Say it louder for the people in the back, Nyleen. Okay. Well, let's talk about the red flags, Nyleen, right? Because this is where things can get kind of start to spiral, right? I mean, things just go from bad to worse. We're seeing more and more audits being triggered by claims for behavioral health services where the rendering provider isn't enrolled with those payers. And that's already a problem. But what's even more alarming is when the rendering provider on the claim doesn't match the documentation in the chart, right, Nyleen?
Oh, no. Oof.
Now what we got?
Well, just like you got claims going out under like a supervising physician's NPI, but the session actually was done by a therapist who isn't credentialed, or like notes mention an intern or an unlicensed provider, but the claim makes it look like actually a fully credentialed clinician handled the visit. That's not just an error, right? So what is it?
To me, it looked like a little misrepresentation, right? And then, what happens when the payer sees it, Nyleen? What they going to say?
Well, your favorite thing to do, which is audit. No.
Yes,
Give me that file. Give me that file.
Give me that stuff.
They're going to see those inconsistencies between who rendered the service and what was billed, who billed. And that's how you end up flagged really for the audit, the fraud, whether it was intentional or not.
Exactly. And, it starts with one denied claim. That's all it starts with. And it can lead to a full-blown review. And right now, once the payer auditors are in your system, they're not just looking at that one data of source of service, that one date of service, that one, source of data. They're looking for patterns. And if they find them, you're looking at recoupments, clawbacks, or even getting dropped from networks altogether. And you don't want that.
Yeah, they already take back enough money as it is.
Don't give them reason.
Lord have mercy. Don't give them reason to do it. So let's talk about a little bit about upcoding, because it's a lot more common than people realize, especially when teams are like rushing or unclear on how behavioral health codes really work. So for example, we've seen claims of like 60-minute sessions when the visit was actually only 30, and that's an upcode because you pay for your time, right? So you charge for your time. Or like a group therapy being billed as an individual session to boost reimbursement, even though multiple patients were present. And that's not just a billing error. That's like a pattern that payers are trained. And I am sure I'm going to regret saying this, but that AI is being coded to check for these patterns.
And you are not lying. I mean, every day when they're talking about AI in healthcare, those are the things that they're looking for. And there's the issue of trying to squeeze behavioral health services into medical billing codes, submitting the EM codes for therapy visits with no physical assessments, right? No qualifying documentation. And worse, no link to a medical condition. And again, that's one of the red flags that Nyleen is talking about, right?
Yeah. So you can't just choose the code that pays the most. Like, you have to choose the one that reflects what actually happened in the room. And, I had a really smart patient come the other day, and I was so proud of her. Like, she had kind of made a fuss at the front desk. And she's like, well, I just need to know if I owe you money, and I want a copy of my EOB. And I was like, look at her talking all this terminology. She's like, no, because I know it's supposed to have some codes on it. So I showed my front desk. I'm like, well, this is a different, EOB that we get. Well, this one is one that we get in the mail. So it's like it's scanned into a different system or whatever. So I printed it out for her, and I said to the patient, see, this is how much you owe. And here is the code that you're looking for. That's that CPT code that we're looking for that reflects what you actually did.
Yeah, exactly. That's how everything gets billed under. Exactly.
Yeah. So when you get a statement, right, patients, when you get a statement in the mail, you got to make sure it has these codes. Now, those codes you can actually just put into Google and see what they mean. So while I went off on that tangent, the point is that if the notes, right, don't back up the codes on what you did, that's when the panic sets in, because now it's not just about fixing a claim. It's about defending your integrity, your provider's license, and really your practice's reputation.
Mm-hmm. And say that again. And when Medicaid or a commercial plan uncovers this, you're not just paying money back. You're now a risky entity. You're classified, on a sanctions database. You're, excluded. You're barred. And in some cases, it can even be considered a criminal case. And you don't want that. We don't want that for people.
So, Shannen, let's talk about maybe how to do it right.
Yeah, let's talk about it. I mean, if you want to have BH services right away, here's where to start. Okay, we're going to give it to you. So credential BH providers directly with the payers. So you're going to reach out to your payers and you're going to say, Cigna, who do you go through? What do I need to do? Tell me, give me the application. Send it to me through fax, email. Blue Cross Blue Shield. Who do you go through? What do I need to do? Send me the application. And you literally have to go down your payer panel and call each one and say, who do you outsource the behavioral health portion to? Give me the information so I could get that application. And then when you doing this, you also just want to ask, is it even allowed to bill for BH services under your TIN? Is that a separate contract? Is there something that falls under your contract for that? What else, Nyleen, do you think? I don't like to talk too much, honey.
Well, no, you got to check your taxonomy codes that we talked about, right? Don't mix them. Know who you're billing, what you're billing, and that they're actually registered correctly with that NPPES to, say that what they're actually doing, that taxonomy code is chosen correctly. And if the provider doesn't know or wasn't set up correctly, please show them. Like, reach out to somebody, call somebody, like, how do I do this? How do I update it? Because you want to track that NPI and that TIN or tax ID number. You want to make sure they're all tied together because it's going to matter for your billing. And then implement internal monitoring early. Track a couple of those claims. Make sure you get a certified coder. Always try to get a certified coder. They did go to school, and you do have to take a lot of these crazy tests, and it's really, really hard. So if you can get a certified coder for especially something like this, it's definitely worth the investment.
Yeah. And I mean, when we say implement internal monitoring early, what that means is you say, we're going to track our first 20 claims that they went through, how long it took. We're going to spreadsheet it out. I mean, some people spreadsheet it out. We're not judging, OCD is OCD. We all have it a little bit. That's what you're doing. And so if there is a denial, if they are asking for a modifier, whatever it could come up, you're going to detect that early before you submit 100 claims. And then now you have 100 problems. You don't want that. And really, that's just what it's about, is auditing everything. Right, Nyleen?
Oh my goodness. But, a really good point here as well is make sure that your electronic health record system is even set up for behavioral health workflows. So I may or may not be using a particular EHR for my practice, and they're trying to sell it to, surgery centers, to be used for surgery centers. And I'm like, this system is beautiful if you run a primary care office. Like, I would say, even for me as a specialty office, I would say it's even bumpy there. So imagine when you have an entirely different service line that has to be billed a certain kind of way. We're monitoring this, we're doing minutes, we have different templates. Like, make sure that if you're going to expand into that, you're not just using whatever kind of system or modifying, because documentation is going to be your lifesaver. So make sure that those workflows, those templates, those notes are set up correctly in that electronic health record.
Yeah, make sure you ask your vendor and say, do you have BH workflows? Because that's what it is really going to fall under is, a BH workflow. And, like Nyleen said, she has one for a clinic, but can you ask them, do you have a surgery center workflow? A specialty clinic workflow?
I have, and it's horrid. It's horrid. It doesn't work because it's like you're trying to adapt something to bill or create surgery center workflows, and it's completely different. It works differently, right?
And so that might be something when you're looking at your EHR is, hey, I'm a medical group, but in the future I might have BH services. So I need something, just so that right? I mean, what do you think, Nyleen?
No, that's great. That's great. Absolutely. That's why you need a planner, and, it's worth getting consultants like MedElevate Solutions, just saying, but that can help you not only open up your practices, but streamline those services and do it right, offer you the good, the pros, and the negatives, and then don't just look for the price of stuff. Just saying, don't just look for the price, because that's always not. So that really talking about price. So is it worth it, Shannen? Like, what do you think? This whole behavioral health issue, going through their whole separate contracting, having a whole separate section of your folders for behavioral health, is it worth it?
Yeah, I mean, it's definitely worth it. But, hiring a company, like that does provider enrollment, like AQC, like other companies out there, I mean, that is really kind of the fastest way to get the contracts up and going, as long as it's a reputable company. And then it's easy enough to add the providers in and do that type of credentialing. But if you're trying to tackle this all at once, it's kind of hard to do it and still run your practice and all the other things that are on your plate. But if you're building your BH program on billing shortcuts, it's going to crumble. And so making sure, again, that you have those workflows is the number one piece of advice we can give you, right, Nyleen?
Yeah, do it right the first time. Take the extra 30 to 60 days to credential and enroll your team properly, and build policies, educate your billers. Educate everybody. Do the checklist.
Exactly. Because, when paperwork turns into panic, what do we say? It's always the patient that is collateral damage. It's not the providers or anything. The practice pays a price, but, it's always the patient that is going to suffer.
Yeah. So if this episode gave you chills, that's a good thing. That means your compliance brain is working.
I know, right? And if your practice is expanding into behavioral health services, let this be your guide. If you know of somebody that also is expanding into behavioral health services, please share it with them so that they can hear it, they can understand it. Don't guess, don't gamble. We really just want to help people do it right the first time.
Yes, exactly. So if you found this helpful, share it, send it to your billing team. Send it to your practice manager that's out there saying, like, hey, let's hire a social worker. Let's go hire a therapist. Or if you just know and have a favorite overworked therapist, your auntie, maybe your childhood teacher, we want to see how they can get paid for their services.
Send it to everybody at this point, right?
Talked about behavioral health. What?
I know, exactly. And it's just so funny because, if you have any show ideas, this came in through a show idea. And so, we do try to, every suggestion that is taken, we take it back, we talk about it, we say, can we make a good episode out of it? And so this is one of the ways that we do get, some good content to be able to bring you guys, because we know you're dealing with a lot as office managers, and a lot's on your plate. And then, the doctor or the owner comes in and says, okay, we're expanding, we're doing this. And you're like, oh God, what do I do now? But, until next time, we'll see you next time on Credentialing Chronicles. Thank you for listening. Woo, that was a whole lot of tea. Who knew doctors had more drama than reality TV?
And if you think that was wild, just wait till next week. We've got more stories, more scandals, and more credentialing chaos coming your way.
And if you love the tea, please don't keep it to yourself. Like to show us you're listening. Please comment and join the conversation. And follow us on LinkedIn, Instagram, and TikTok. Also, share so everyone else can sip with us.
Yeah, so see you next time on Credentialing Chronicles. Stay credentialed, not canceled.